Hello, and welcome to ClinData Insight's presentation on CDISC compliant data submission. ClinData Insight is a biometrics consulting firm based in the San Francisco Bay Area, specializing in biostatistics, statistical programming, CDISC implementation, big data for life science, and talent solutions. In today's presentation, Kevin Lee will go over CDISC compliant data submission. I'd like to start off by introducing Kevin. Kevin Lee is the Director of Data Science at ClinData Insight. Kevin has more than 10 years of CDISC experience, helping many organizations to implement CDISC standards. Kevin has worked with industry thought leaders, FDA, CDISC, and FUSE on standards-driven electronic submissions such as CDISC and Electronic Common Technical Document. Kevin currently belongs to CDISC Atom and Share team, developing CDISC data model, and also serve as a FUSE Computational Science Symposium committee member for the industry collaboration with FDA on standards implementation. Kevin is a frequent CDISC speaker at various conferences. He has presented more than 20 papers on CDISC implementation. With that, I would like to hand the presentation over to Kevin. Kevin, you should be receiving control of the presentation now.
Okay, thanks, Marlene. I just want to take this time to thank my wonderful colleague Marlene to prepare this talk for us today. And thank you all for joining our talk on today on CDISC compliant data submissions. Our agenda starts with the questions. What will happen in December 17, 2016? Then why is that important? And how and what to prepare for that day? And we also talk about FDA support and conclude our presentations with the final thoughts. So what will happen on December 17, 2016? According to FDA, data standard catalogs, all the clinical trial study starting after December 17 will be required to have CDISC compliant data. Here, the important word is required. What they mean is that FDA mandate CDISC compliant data submissions. And the next question is, why that is important? And we actually asked this question to FDA, and can FDA refuse to file to receive if the submission data does not follow CDISC standards? And they say yes. So right now, it is very important to implement CDISC standard in your data submissions. So how to prepare data submissions? You start with data standard catalog using Electronic Common Technical Document and CDISC standards, and refer to Study Data Technical Conformance Guide from FDA. Data standard catalog contains standard type and its versions, and FDA center information such as CBER and CDER and CDRH, and FDA support start date, end date, and also FDA requirement start date and end date. If you look at the example, STTM version 1.3 and IG 3.13 will be required by CBER and CDER in XPT format on year 2016, December 17. And all other STTM and ADAM and SAN defined domains are follow the same requirement date by CBER and CDER and also CDRH. So this data standard catalog explained what standard will be required by whom FDA centers, and what standard will be and their support or requirements. Electronic Common Technical Document basically explain how industry prepare electronic data or electronic format. So it requires file formats such as PDF, TXT, XML, and XPT. And it also has summation folder such as Module 1, contain administrative information and prescribed information. And it has a document that are specific to each region, such as application forms or labeling information for the use in the regions. And Module 2 contains the study document summarizing the findings from each section of the submissions, all the elements of drug development process. And Module 3 contains the drug substance and such as active ingredients and drug products. And Module 4 contains the animal study report, and Module 5 contains the clinical study information that we're going to focus in this talk. So let's kind of look at the naming convention of electronic file according to electronic common technical documentations. You can use a lowercase. Do not recommend to use the uppercase. And you can use number from 0 to 9. It's recommended to use a hyphen rather than underscore, but no special characters. And then file name should be less than 64 characters, and its extension cannot go more than 230 characters. And also, data center catalog introduced CDISC standards. What standard will be required, such as STTM, ADAM, and SEN, and define.xml. Study Data Technical Components Guide is introduced by FDA, and it provides the recommendations on general considerations by FDA. And it is a non-binding document, so you don't really have to follow, but we strongly recommend to follow all the things in Study Data Technical Components Guide, because that's what FDA recommended, that's what FDA wanted. So until now, we talk about why the data submission is important and how we prepare. So now let's talk about what to prepare, more accurately, what to include in data submissions. We have to prepare CDISC data and also submission supporting documents such as reviewer guide and electronic format of submission package according to electronic common technical document. So CDISC data, according to Data Center Catalog, which is now version 4.4, so we include CDISC data such as STTM in oldest versions, ADAMS, and SEN, and define.xml. We also need to prepare the data submission supporting documents such as study data, standardization plan, which display what standard will be used for each study, and also usually one standard plan for one indications. And study data review guide is pretty much STT implementations in each study. And analysis data review guide is ADAM implementations for each study. And non-clinical study data review guide has not approved and it's not active yet, but it's going to be for SEN implementation for each study. We also need to prepare electronic format according to ECTD guidelines. So if you look at all the electronic files that we need to prepare and submit to FDA, and those files will follow electronic common technical documentation guidelines, such as protocol, SAP, electronic case of form will be PDF format, STTM, Atom, and SEND will be XPT format, which is SAS transfer file. And CSR is going to be PDF format. And define.xml is usually XML format, but another time FDA also wants PDF format just so that they could print out. Atom SAS dataset, Atom SAS program or SQL SAS program also included in the submissions, but we have to make it as a text file, not as a SAS file. So as you see that you could name as a .txt and then send it to the electronic submissions. And also, obviously, the reviewer guide also going to be PDF format. So FDA also mandate that CDISC data submission, but at the same time, they will provide some help. FDA said that there's no waiver, but sponsor could apply for the waivers. If the sponsor cannot do CDISC submissions, the sponsor needs to prepare written waiver requests, indicating what special requirement that sponsor cannot do or also seek for waivers, and the reason for it, and any discretion for the alternatives. And FDA strongly recommend that you need to discuss the waiver request with FDA prior to or in IND meetings, and submit the request in writing prior to submissions. When you meet with the FDA on pre-IND meetings or prior to end of phase 2, you could discuss about study data standardization plan and also data standardization issues. And FDA annually or more often prepare the study data technical conformance guide, and it will explain about requirements and recommendations from FDA perspective. And also sponsor could arrange pre-submission technical review on the sample data. So you could actually test your sample data whether it's going to be CDISC compliant or not in FDA perspectives. So before December 17, 2016, CDISC implementation is pretty much recommendation. But after December 17, 2016, it will be requirements. So now the sponsor have no choice but to follow these requirements. So it is always better to start early with the standard-driven data and document preparation, such as CDISC implementation and electronic common technical documentation implementations. Again, thank you for your review on these presentations. And if you have any questions about the CDISC electronic summit, you could actually contact us. Thank you. And Marlene?
Thank you, Kevin. Thank you. That was very informative. And thank you for viewing this presentation. We will be adding additional videos like this one onto our channel. Please subscribe to find out when we'll post new videos and to find other videos like this one in our library. Thank you.
Thanks, guys.